This is Dr. Kurt Samlaska. I'm going to be reviewing a case presentation on the atomic tattoos. Most of the information I'm going to be providing you actually comes from this single article written by Elizabeth Wolfe and Anne Laumann. It's an excellent article. It's published in the Journal of the American Academy of Dermatology in 2008. So if you're interested, I highly suggest that you get a copy of this article. Unfortunately, it is not an open-sourced article, so you'll have to purchase it or find yourself a dermatologist who would be able to get you a copy. The case I'm going to review is a 73-year-old white female who, on routine follow-up, was noted to have tattoo pigment along her left flank. Blood type tattoo was applied when she was around the age of 12 in 7th grade at Hobart, Indiana. And she was told that this was a Cold War tattoo due to the risk of atomic bomb targeting of Gary, Indiana's steel industry. Her blood type was A positive. And here is a photograph of her A positive tattoo. Blood typing was first developed around 1901, and Rh factor determinations appeared around 1937. Blood type tattoos were first used in World War II in Germany. And many of the soldiers were tattooed with their blood type on their arms, so in the case that they were injured, they would be able to quickly determine what type of transfusion the patient would require. Nationwide blood typing for civil defense programs were recommended in 1948 by the Committee on Blood Banks in the American Medical Association. And they recommended that thousands of donors in adjacent and remote communities would have to be bled for atomic emergency. In 1950, Dr. Theodore Seifer of New York State Medical Society pushed for blood tattooing, and this essentially was dead on arrival. It was never accepted or adopted. Likewise, a program in Pennsylvania state civilian defense officials approved plans for every resident in the state to be tattooed with their blood type, and this again was dead on arrival. The plans were rejected because of predominantly the error rate. Approximately 10% errors occurred in blood typing of the day. Probable utilization of universal type O donors was one of the other recommendations that most of the doctors believed in at that time. There was a lack of competent technicians and sufficient typing serum to justify the program, and it also came down to cost. In 1951, the Secretary of Defense charged the American Red Cross to coordinate the blood needs for armed forces and for civil defense. In 1952, the Civil Defense Office blood typed about 1.5 million people in Michigan, and this included a small town named Jackson. The blood type and Rh factors were placed on small plastic dog tags, and a survey of patients or civilian population in Jackson showed that of the 665 respondents, 72% carried the dog tags, while 60% refused tattooing. In June 1953, in Illinois, Indiana, Massachusetts, and Utah, they adopted programs for blood typing for all residents using either dog tags or tattooing for identification. The Chicago Civil Defense Tattooing came up with a fairly morbid assessment. In 1950, Dr. Andrew Ivy approved a policy of blood typing tattooing for all residents, estimated that an atomic bomb attack in Chicago Loop would result in about 61,000 deaths, 231,000 injuries, and there would be a need for 825,000 pints of blood within 36 hours. Tattooing would be virtually painless and take less than 5 minutes, would cost about $1 per person. The recommended location was chest placement because arms and legs could be lost in a severe nuclear attack. Dr. Andrew Ivy was the vice president of the University of Illinois. He was an AMA consultant for the Nuremberg Tribunal. Each member of the Waffen-SS had a blood type tattooed under the left axilla or inner arm or chest wall. Although ratified by Chicago Medical Society, it was never implemented in Chicago. Dr. Ivy's was the main proponent of blood typing and tattooing. And this is a picture of Dr. Andrew Ivy. Here's a photograph of a German troop with blood type AB. Blood type tattoos were recommended in Northwest Indiana, and Lake County Medical Society gave support to the program. In the spring of 1951, some 5,000 citizens were typed over a 6-week period. Operation Tat Type was born, and it was administered by using a tool called a vibratool. 1,000 volunteers were typed at the county fair, and by December, 15,000 citizens were tattooed. In Utah, this was promoted by Dr. Omar Samuel Budge with special approval from the Mormon Church. And this is a picture of Dr. Budge. Here's a picture of an O positive tattoo, and this is the tattoo of my patient. You can see here is the recommended site where the X is in the lower portion of the axillary region. And this is a diagram of the actual tool that was used for administering the tattoos, the so-called vibratool. And this is an example of the blood typing card that was used at that time. The decline of blood type tattooing programs was due to a number of factors, number one of which was that doctors would not rely on pre-typing. The AMA and Federal Civil Defense Administration supported emergency plasma administrations regardless of blood type to avoid typing errors. Tattooing versus dog tags was very controversial at the time. Another cause was that tattooing is prohibited in the Bible and was rejected by most cities for a number of other reasons, such as severe burns. Dog tags were preferred, time, effort, and the expense. So in conclusion, blood type tattoos were a short-lived phenomenon limited to 2 small communities. Why did these 2 communities participate? Well, one of which is Dr. Ivy's substantial influence, the possible test sites for the Army, and this would be used for the rest of the country depending upon how successful the programs were. There is speculation that the Lake County program was a walking blood bank for the Chicago area, and civilians were persuaded the program would protect them in the case of an atomic attack. Doctors did not trust tattoos for medical information, and this was predominantly, again, related to errors in typing.